Hello, it's Dr. Rhonda Johnson. Today is Tuesday, December 22nd, 2020, and today I'm going to be discussing the COVID-19 vaccine deployment and trying to explain in basic terms these phases of deployment across the United States and help you to understand what phase or what group or when is your turn in the line for the COVID-19 vaccine. Well, folks, we've been watching now. This is week 2 of the vaccine deployment. Across the United States, there has been a glimmer of hope for our healthcare workers who have suffered so much death, illness, stress, and exhaustion, taking care of patients who have critical COVID-19 illness. We have seen countless people get shots in their arms now, including a sitting vice president and a president-elect. So who's next in line and where are you in this process? Well, as you probably heard, the Centers for Disease Control has an advisory committee on immunization practices. It's called the ACIP. And they're comprised of some of the brightest medical experts and public health experts in the land. And they have developed a playbook, which is an interim guide, which has been adopted and modified by most state health departments. It's based upon the assumption and the reality that vaccine supplies are currently limited. And the goal is to vaccinate as many people that want the vaccine based upon your risk factors for COVID-19. Now, right now, there are 3 phases of this deployment. Phase 1 is while the vaccine is very limited in terms of the number of doses that are available. Phase 2 is when we have a larger number of doses available and the supply is likely to meet the demand. And phase 3 is when there's likely to be sufficient supply of this vaccine. The COVID-19 vaccine will ultimately be widely available, and it will become a part of routine vaccination programs that are run both by public partners such as the health department and private partners such as your private doctor's offices and hospital groups, etc. But right now we are in phase 1A, and those are paid and unpaid persons who work in healthcare settings or who serve in healthcare settings who are directly exposed to patients or infectious COVID-19 materials. Then after that comes phase 1B. Well, the ACIP, again, this advisory group, they met on Sunday and they defined this next group because, again, we've been watching all the healthcare workers get the shots. Next comes phase 1B. So who are they and are you in this group? Well, they defined phase 1B as adults ages 75 and older and frontline essential workers who should receive the COVID-19 vaccine, and phase B. Now, we're still in phase 1A, so in many places, some states are just getting their vaccine supplies, so I'm not quite sure when we'll move into phase B, but 1B, but you'll find out about it on the news. So who are these frontline essential workers? Well, they're defined as first responders, folks who work in education, food and agriculture, manufacturing, correction workers, U.S. Postal Service workers, public transit workers, grocery store workers. Now, these essential workers have been defined according to an agency called the Cybersecurity and Infrastructure Security Agency. And they define them as a frontline essential worker is someone who works in a sector that is essential to the functioning of society. And for this COVID-19 vaccine, these folks are substantially at higher risk of exposure to the virus because they can't socially distance in the workplace. So then the next group will be phase 1C. And these are comprised of adults 65 to 74 and adults 16 to 64 with high-risk medical conditions and all other essential workers. So again, don't know when phase 1B and 1C start. We're still in week 2 of phase 1A. But folks, I think you need to be really thinking about your COVID risk. Discuss it with your doctor, discuss it with your family. Because if you're an essential worker, it won't matter your age. You are working in a job that places you at high risk for COVID-19. And I want to especially call out African American and Hispanic men. All of the data analysis shows that men, regardless of race, have a higher death rate from COVID-19 than women. That's all races. But Hispanic and African American and indigenous men have higher death rates than white men, significantly higher death rates than white men. So folks, if you have a beloved male member of your family who works in one of these essential jobs, please be talking to them about getting the COVID-19 vaccine. We need our men. We need them as fathers, grandfathers, brothers, uncles, sons, friends, loved ones, husbands. We need them. And they are disproportionately dying from COVID-19. So I just want to have a special appeal to all family members to be reaching out to your men in your family to discuss the COVID-19 vaccine with them. If they're 75 and up, if they're in an essential job. Please feel free to send me your questions or concerns that you may have. I'm not an expert. I'm not a virologist. I'm not a vaccine expert, but I will do my best to try to help you find the answers to your questions. Now, keep in mind, folks, that your state may be defining their vaccine strategy differently. The CDC playbook is guidance, but not the law. Okay, this is my message for today. This is Dr. Rhonda Johnson. As always, my views are my own. My only intent is to help save lives during this pandemic. So stay safe and have, as always, a blessed day.